spoke last time was to throw ideas together and to basically figure out, kind of vote on the idea of what can we as a team pursue. And I think we'll put this up on Meetup as far as what are the emotions, what are the stratifications around patients, all this stuff. And I think we'll just keep the conversation going. Again, to your point, we want to make this stuff actionable, not just a conversation that we gathered a lot of information and so what, right? And I think we defined the stratosphere of all the players. Where are the gaps? So, for example, I want to be empowered to get there on time and meet my I don't want to sit there for 2 hours. Well, the ZocDocs and there's a couple of others that are around that are solving these issues. I want to get the information where I want it, what time. So there's definitely already players that are starting to emerge, but there's still gaps. So I think the key here is to identify those gaps and understand where we as a team can kind of pull together. And Carrie, you mentioned that you met somebody here, you found a gap, and you're already starting a business and moving things forward. So that's great. That's what this forum is about. And
so here's a while ago, you talked about action, and I'm an absolute believer in that. So how about taking a weekend off, going to Walgreens at Times Square, 8 o'clock, 8 to 8 in the evening, asking every person who walks into the pharmacy 3 questions. So what you offer the generic if you had it branded? Did they actually ask you, or did they actually check any kind of contraindications to the prescription that was prescribed? And maybe 2 more questions.
I would have to stay out because that would be a conflict of interest for me, my personal employer, but
just post it online and see how people react to it. I mean, just
you raised something really important. Right now, there was an initiative that, in my opinion, totally failed at the pharmacy level, which was supposed to be utilizing that resource of the pharmacist as a counselor. What do? You go in and you sign away the right to any counseling. You don't even look at what they're offering. Oh, would you sign here? Would you sign here? Would you sign here? Here's your med. That is an example of what was actually a pretty good idea that had no implementation structure to support it. It just was an idea living out in the air. And there was never anything done to really have that happen. Pharmacists are an incredible resource for patient counseling. Unbelievable. Sometimes patients are so much more comfortable talking to them than they are to their own doctors or their own family members. But we don't tap into that. The question that I want to leave you with, in addition to what Eugene said, is we also bandy the word around health. But health, in our vocabulary, for the most part, means illness. And we mix up healthcare and wellness. There's no differentiation in the way that we use the language. And that's something else that I would just challenge people to think about between now and the time that we meet again. What does that mean? Am I empowering a patient to stay healthy or get healthy? Or am I empowering them to just manage their sickness? These are different interactions, and these are different, metrics for outcomes and so on. And I don't think that we can mush them all together. So I just would like people to just be thinking about that. And also be thinking about what do we actually physically want to accomplish in this group. Because I belong to other think tanks, and it's great. It's really exciting to sit around with really smart people and talk, but where's the meat?
Oh, I have a proposal. Like last time, we spent 10 seconds, let's say, to introduce ourselves. Today, let's spend 10 seconds each to say what the expectations are from this meetup. Each one.
And don't feel on the spot.
And if you mind me filming, just say, I'm not gonna film.
My expectations. I just signed up tonight.
Are you feeling empowered?
I certainly do. I would say that we focus on something very specific and not try and boil the ocean.
What is the specific?
What is the specific?
free your device.
In every office, every device.
Yeah, I mean, this is a cop-out, but just something that's tangible and actionable, that you have something to show for,
Okay.
I mean, it's tough because all the big players, there are a lot of big players, government, payers, big corporations that control a lot of, and then the medical system that control our healthcare. But there's a lot of public policy debate going on right now on a lot of specific issues, and if we could come to some consensus on some maybe very small public policy issue, and get our congressman in here for a meeting or write to them. There's a lot of ways we could, this is really good thinking, and this is the kind of stuff that does shape public policy.
So public
channel
policy. Next.
I would just kind of echo that, like a small, narrow, but effective, what we think is effective argument or change, rather than some like pie in the sky out of left field type idea.
And that decision delivered to whom? To
Well, that's what I was asking before, like who are we advocating to? I mean, I'd like to hear more about this. This is my first healthcare, actually really delve into like the healthcare, health technology society, so.
well, some people from Health 2.0 community addressed Obama. So here you go. That could be one of the channels.
Yeah, I guess, well, a lot of that's going to change or prospectively change soon, maybe.
Okay. Anyone else?
Yeah, no, I joined, I guess, Meetup.com 2 weeks ago. I spoke to a venture capital guy who was interested in investing for our first public round. And he goes, you know about Meetup.com? I said, no, signed up, and all of a sudden, I discovered this group, right? So I've started this company 3 years now, invested quite a bit of my own money, and I thought it was very interesting that a group was gathering to talk about the consumer-centered nature of healthcare. I really came tonight from Princeton, took the train, took the subway here to Washington, but I really wanted to be with a group of individuals who I could network with. So these are business people, these are skilled thinkers, these are people looking for ideas, these are people who have applications, tools, etc., so that I really can surround myself with the best and the brightest.
Okay. 10 seconds up.
I'm a consultant to a major media company, and I'm actually putting together a documentary about the perfect reading movie. It's a very huge project, as you can imagine. So trying to get futurists, students, healthcare providers, and what the issues are, and with possible inclusion of some things. So I would love to talk to anybody who has any ideas or products or anything like that. It's a very practical thing for me of why I'm here.
Okay. Carrie, you'll go last. I'm sorry. You actually have results. Anyone else?
Yeah, I think this group would be, it's the second gentleman over there, forming educated opinions on a lot of the federal and state healthcare payments. And I think, we can then communicate those opinions outside as a group to our congressmen, all of our contacts within the healthcare
Back
community.
to the public policy.
Yeah, public, that's right. I think we could have a fantastic effect on public policy.
Okay. Anyone else? All right.
Yes, I'd like to learn more about how I, as a financial and insurance professional, can just to learn more about how I can service and I guess partner with people in this industry and or advocate for them back to my industry, because there aren't a lot of professionals in my industry, unfortunately, that aren't reaching out to groups like this. So.
Okay.